Welcome back, and back to our topic of the day. Hundreds of young recently graduated doctors who completed community service face a bleak future because they're currently unemployed. So how do you think this situation could be resolved? That's our question that we're asking you this morning. You can send us your comments at the agenda _SABC, or you can call us on 0117140661 or 0117140662. We'd love to know from you. So please do connect with us. And speaking of which, in recent times, South Africa has grappled with a pressing issue, that of the unemployment of its medical graduates. Despite the country's urgent need for healthcare professionals, financial constraints and bureaucratic hurdles have led to a significant number of qualified doctors facing unemployment. Now, this situation has given rise to a palpable sense of frustration and uncertainty within the medical community. However, recent developments offer a glimmer of hope for a potential turnaround by April this year. So, to highlight the plight of unemployed workers, we're joined by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, virtually. Dr. Dhlomo, very good morning to you. Thank you so much for joining us. Welcome to the agenda.
Good morning, Simpio, and good morning to all your viewers at home and everywhere.
Now, Dr. Dhlomo, is the state of unemployed doctors a financial issue, since Health Minister Dr. Joe Phaahla said he would wait for the Minister of Finance, Enoch Godongwana, to first table his budget speech tomorrow?
Yes, but maybe it is always important to give a context to this, that it was our own creation as a department and this government that 10 years ago, from all universities, there was always an output of about 1,200 doctors. We then requested universities, expanded the program. We also sent some of the students to Cuba to expand. Hence, now we have about 2,400 medical students who qualify every year. Of that, we are happy to inform you that all of them, those who are doing a 2-year internship, are employed, placed in various hospitals. The second cohort are those who are doing community services that are also employed everywhere. The challenge has been with those who have qualified, finished their community service, as which we call now medical officers independent practice. As you might recall, some of the young ones whose family backgrounds are well stable are able to join their parents, get a loan from the government, from the banks, and parents are able to set them up in Nongoma, set them up in Sandton, set them up anywhere, and therefore they are all there. There's a big number of medical doctors who are saying, but government, you spend $1 million in my training. I signed that contract, and my expectation is that you also take me. There's a contract that I will also work for you for the number of years to deal with that. So I was not expecting that I would have these challenges. And we understand that very much. So our own creation of an expansion of medical training has now had a bit of a hiccup with the fiscal challenges. Because if you top slice the Department of Health at just about 2%, we really have a significant amount of about $1 billion or $2 billion that actually goes out of our budget. Hence, there's been a discussion over the past 2 weeks, which then our minister on the SONA debate tabled a statement that said there will be a meeting, there will be an announcement tomorrow with the Minister of Finance in regards to alleviating this challenge. I have been even to the Eastern Cape in KwaZulu-Natal to speak to the doctors there to say, we may not be able to employ you today and tomorrow, but we are working around a situation where all those doctors who are unemployed will be employed come 1st of April this year, because of a very cordial discussion, a positive impact that is coming in from the Minister of Finance, that we should be considered favorably as a department come 1st of April, which you probably know, Simpio, is the beginning of a new financial year.
So, Dr. Dhlomo, you're saying that unemployed doctors will be employed by the 1st of April this year. Is this the official position of the Department of Health? And how many doctors are you going to employ this time around?
It's an official position of the Department of Health, as actually we indicated through the Minister on the SONA. We are collecting the information, Simpio, in terms of how many, where are they, and the numbers may not actually be confirmed. But I was actually with the DG as today. Today is the last date. All provincial departments, all unions that are actually supporting the plight of the doctors should be making their final submission, so that when the minister actually announces tomorrow, We know that a medical officer grade 1 is supposed to earn so much, this, that, and the other. So he would be announcing almost close to a bold figure based on the numbers that we are submitting to the Minister of Finance office today. So all of the people in the country, be it the Department of Health in Limpopo, everywhere, Northwest, they submit as of yesterday, and all trade unions who have something to do with the data of those students unemployed, they have to submit, so that our announcement tomorrow through the Minister of Finance is based on the figures, actual figures that we are going to submit to the Minister of Finance.
All right. Any specific policy changes or programs in the pipeline to, to try to contribute to a positive shift this financial, or rather next financial year from April?
Yes, Simpiwe. In 1994, there were districts and provinces. Let me just give you an example for KwaZulu-Natal, where I was part of for 10 years.
Okay.
There's a district in Pietermaritzburg which had a hospital called the Itindale Hospital, now changed to Herigwala. That hospital was actually in a turmoil of political intolerance and violence, and then we had to get a particular allowance. We didn't call it a political allowance, we called it a rural allowance. But that since the country has since stabilized, Prince Msheni around Mlaza again, and also Prince Cecilia Matwane Tanzania, that's why I learned. Now, those hospitals are big, have about hospital beds of about more than 500. All healthcare workers working in there got what we call a rural allowance. And there's no more political instability in those areas. And therefore, we were actually putting it on the agenda. Let's remove that rural allowance. Was a rural allowance for me and you, Simpiwe, can employ another doctor. So those are discussions that we want to put in place to say, colleagues, trade unions, doctors, we seem not to have those issues right now. And therefore, can we do that? But another very significant one, which we want to put on the table, Simpiwe, is what we call remunerated of work of outside public sector, RWAPs, which some of this is getting abused. We give you that RWAPs and story, Simpiwe, and at 10 o'clock you leave the hospital as a senior doctor and go and do your private work. And it was not meant like that. It was meant to say, we recognize that at 4 o'clock you knock off and go and do your other private work. But the private work for some of the doctors starts as early as 11 o'clock, and they leave hospitals without senior supervision. So those are things that we want to look into and say, no, do we really have enough doctors? Maybe yes, maybe not. But what happens with that extra pair of hands that leave the public sector midday and disappear, and you never get to see them until the next morning?
Well, the answer to that question is we don't have enough doctors, because I do understand that one doctor sees at least 3,000 patients in public institutions, while the health budget keeps on decreasing. It decreases by at least 1% every single year. And this is as a result of the malfunctioning medical equipment, because in the Eastern Cape and Limpopo state orthopedic services, these have closed down because of no equipment.
Yeah. Let's add on. I'm saying, yes, there's not enough doctors, but there are some who are there but do not even finish the whole day's work while they're there. That's, the other one is the one of rural allowance. That one I must admit. And I've actually been asking ourselves, why do we have a broken X-ray machine in the private hospital that gets fixed the next day, but the broken X-ray machine in the public hospital gets fixed after 6 months? What difference? Aren't we buying from the same supplier? Why are the conditions different? Why don't we make the same conditions? Say, you shall fix or bring a new X-ray machine within 24 hours. The private healthcare sector can do that. I don't know why when we do these contracts with the government institutions, we can't do the same.
And on the issue of the unemployment of doctors, Dr. Phahla, the health minister, said that medical negligence claims also contributes to government being unable to hire more doctors, because in one province alone, about 900 million rand was paid, to medical claims. So this is absolutely bizarre, Deputy Minister, the fact that this is on an ongoing basis, yet it's not being solved.
Simpiwe, it comes to say, what came first between the egg and the chicken? Now, I'll tell you this story. If you don't have enough pair of hands at work, you are likely to have those few overburdened and likely to make mistakes. I really agree with you, and therefore you are paying more on medical negligence. So where do you start? yes, maybe optimally improve your staffing levels to such an extent that you would see a decreased number of malpractice and negligence. But again, the other thing that calls on that is actually get your IT system. But there are few hospitals in the country where we are having electronic and paperless contact now. If you go in there and make a bizarre claim that this and this happened to you, we are able to look in the computer. But a majority of our hospitals, we don't have records. They are stolen, and therefore, if Simphiwe comes into court and say, this is what you did to me, we have no backup, we have no records. Until we go electronic, and we improve electronically and also improve optimally our staffing, that's when we are going to be seeing a decrease in terms of malpractice. It is true, one province spent last year 900 million on medical legal claims. That was equivalent to employing all these doctors that we have not at home. So you need to know where to start between the chicken and an egg. You must actually tell, please, let's optimally improve, because we are likely to decrease these other adverse events in the health sector.
All right, Dr. Dhlomo, great chatting to you. Thank you so much for squeezing us in your very hectic schedule this morning. We do appreciate your time.
Thank you very much, Simphiwe, and thanks to your viewers.
All right, that was Dr. Sibongiseni Dhlomo, the Deputy Health Minister, just weighing in on the issue of the unemployment of medical doctors here in South Africa.